All right, so when you see that and you watch that, indeed, you know that we're ready for the Congress as well. We're covering it. We're going all around. Our team, as you know by now, already in Tamale, and more of our reporters will be joining them as well. But for now, though, let's talk some Rotary Club business. There's the Rotary Family Health Day, which is beginning on Thursday. Some free health screening for the whole family. So why don't we just open it up and see what it's all about and if you can be part of it. I'm being joined by Moses Ni Okai Ayi, and he's a member of the steering committee of the Rotary Family Health Day, but he's also the president-elect of the Rotary Club for Accra West.
West.
Yes, Mr. Okai Ayi, good morning to you.
Good morning.
And congratulations. So when are you fully going to be addressed as president?
It's just around the corner. Rotary year begins in July.
In July.
So I'll be taking over in July.
How many years would you be doing as president?
Just for a year. It's an annual thing, yeah.
Okay. And then you have the opportunity for standing again?
Well, in certain clubs we have what we call the recycle presidents. That's when they don't deem it fit to elect any new person other than a past president. Then the past president will be elected again to take over.
Okay. So what did you do to become president? I mean, you campaign?
Oh, unfortunately, no. There's no campaigning in Rotary, and every club has to elect their president, and they always look out for people who are quite active in the club, who has been participating in most of their programs, and they can trust and actually leave the, let's say, the whole business of the club in their hands.
You know, some people see the Rotary Club as, you know, like a group of privileged persons in society. Is that what it is?
Well, if you say privilege, well, I will say yes, because Rotary, or membership in Rotary is, let's say, business and professional leaders, sometimes community leaders. And of course, for every leader, you should have done something right to become a leader, and you should be in command of so many things, like in business, in professions, in the community. So definitely you should be a privileged person in the society.
Well, let's talk about your family, and I'll come up to, I think I would also want to ask you, if people want to join, what would it take for them to join? But let's talk about your Family Health Day, which you're launching today.
Yes.
What is that all about?
Oh, Rotary Family Health Days actually originated from the States, where we have...
as in the USA?
As in the USA. And where we have the Rotary Family Health and AIDS Prevention group. We call them the action groups in Rotary. They started this whole thing in the States because the founder actually lost the son through AIDS. And at the time, in the 80s, you know, it's a taboo to even talk about AIDS. So she started it in a small way, and it has grown to become the Rotary Family Health and AIDS Prevention. Now she's gone out of the States, and I mean USA, and now helping other countries around the world. This is the 5th or 6th country that we are starting this Rotary Family Health.
And you're starting just this year, 2014?
Year, exactly. Other countries in Africa has already done it twice, thrice, and even 4 times. South Africa, Kenya, Uganda, and Nigeria has already done it. We are now starting.
Okay, so what would it mean when it is duly launched?
It means we are now going to have an annual Rotary Family Health Days in every year. Actually, it takes place in all the countries at the same time. But unfortunately, for Ghana, we are having our district conference, district assembly and conference within the period that the other countries are having theirs. So we were allowed to shift it to an earlier date, which is 2 weeks before the rest will be doing it. But subsequent years, I believe we'll all be doing at the same time.
And this is from Thursday to Saturday. So what's going to be happening within that period?
Within that period, we have the Ghana Health Service, I mean, in collaboration with Ghana Health Service and the Ministry of Health, selected 30 sites 30 communities, deprived communities, where we're going to provide free health service or health services. We have the core services which will take place at all the centers or all the sites, and then we have the add-on services which will take place in certain selected sites or communities. The core services include HIV testing and counseling. We have the malaria screening, we have the TB screening, we have deworming, we have what do you call it, distribution of condoms at certain sites.
But you don't preach abstinence?
Oh, we do, but for let's say family planning purposes, we still need the condoms. Others, also, of course, matured adults may be reckless and contract any of the STDs, so why not the condoms? And
your add-on services would be?
Will be eye screening, dental screening or dental care, and then we also have the TB diagnosis. Initially, with the core, we have the TB screening. If anyone is suspected to have one or close to having TB, then you have the TB diagnosis.
Yeah. All right. So is this happening only in the Greater Accra region?
No. Yes, I will say yes, because it's in Accra and Tema for now. Being the initial or the pilot, we're starting it in Accra and Tema. But subsequently, we'll take it to the regions.
So this is 30 centers across the Greater Accra region, which includes Tema.
Exactly.
So would you want to give us, a bit of where people can go to, and this is open to anybody at all?
Everybody is invited, especially the communities that we selected are very underserved and underprivileged communities, so we expect them to take advantage of.
Do you have a list of the?
Yeah, we have a few. If I will start from Osu, where I think is the eastmost part of Accra, we have one center at the Osu Super. It will be taking place at the Mandela Park near the castle, and then we have the next one being the Art Center. We have one or two sites at Sahara, which is the Odona area to Adabaka area, and then we have one at Tudu that will take place at the CMB police barracks, and then when we come up to Kaneshi, Okankwe area, we have the Kaneshi market, we have the Aidiki, we have the Aigbe town, the North Kaneshi area, Aigbe town, we have the Penkwan, we have Kiseman Christian village, and then if we go further, let's say west, we have the Ablekuma area, the Mamprobi, Jamestown 1 area, which is the Choko area. We have the Mamprobi. One is also taking place at the Mamprobi Gethsemane Church. We have the Agege area.
So that's like Dansuma.
Yeah, Dansuma, Agege area. We have the Shiabu taking place at the Faith Evangelical Church. And then we have further on.
But the people in Medina, Adenta, thereabouts.
Yeah, unfortunately, this year is concentrated in the southern part of Accra. But eventually we'll spread it up to virtually every corner. Because it's a pilot, we try to make sure we concentrate in an area where it can be well managed and supervised.
And where you also do know that the services will be very much needed.
Exactly. We have some even taking place in Bukom. We have some at Agbogoshi Market and
so what's going to happen, because these are not clinics? So what would they find when they come to the sports?
Good. We have posters around. We've pasted posters all over the communities, directing them to the various spots. And the selected areas are really not clinics, but they are what they used to call the CHIPS compounds. But with the CHIPS compounds, you just need a little space, maybe a single table and a chair, and you can take care of a lot of people. But in this case, because we are targeting a huge number of people. We're targeting 1,000 people per site. So we decided to select, like the Ghana Health Service has always done, when they're having these outreaches, they select spacious places like school parks, churches, compound, football fields, and things like that. So we've selected these places where we'll mount tents.
Okay, so this is an open place.
It's an open place. We'll mount canopies, we'll put tables and chairs under it, so that at least crowd control can be managed.
Okay.
Because if you go to a tiny place, it will be very difficult.
All right. So where are the doctors coming from? Are they also members of Rotary?
No, we have a few partners in this project. And one of the partners I've already mentioned is the Ghana Health Service.
So they're giving you
doctors.
They
are giving us nurses, actually, because it's training. They are giving us nurses and nursing supervisors who man the tables for the specialized areas. And then Rotarians will be doing the non-specialized areas like deworming, distribution of condoms and the like. Those ones are no special.
So this starts from Thursday. What time to what time each day?
Thursday by 8 a.m. all the centers or all the sites will start the program. And we estimating services to continue up to about 2
p.m. in the
2 p.m. in the afternoon, because if you take people beyond 2 p.m. it means you'll be staying there till about 6.
Yeah, besides,
exactly.
I guess it's not a bad time, considering people have to go back to their normal chores.
Exactly. So we're giving ourselves between 8 a.m. and 2 p.m. But after 2, those who are already on site will be taken care of.
Okay, so you'll be at these same centers from 8 to 2 p.m. each day, from Thursday, Friday, and Saturday.
Correct.
Okay, so big question: who is funding this project?
Okay, like I was saying, we have a lot of partners. We have Rotary International. We're getting a lot of funding from the Rotary Foundation.
Okay.
We're getting funding from our partners like Coca-Cola, like CDC, that's Center for Disease Control. We're having support also from Ghana Health Service and Ministry of Health, who are providing most of the vaccines and the malaria test kits and the rest, AIDS and the HIV test kits and the rest. And then we also have USAID, who are also supporting us with logistics. They're providing some of the things like condoms and the bed nets and other things. Okay. And they're also supporting the steering committee in our activities.
This is a good exercise. But just finally, if somebody wants to be part of Rotary, how?
Oh, everyone is welcome to join Rotary, but Rotary is by invitation. Joining Rotary is solely by invitation. So once you express interest, any Rotarian can invite you to visit their clubs. And as you continue visiting, when you show interest, the club will invite you to join. Okay.
All right, Mr. President-elect.
Yes, ma'am.
Can I say thank you for your time this morning?
And
we know that you're launching the Family Health
Rotary Family Health
Day.
Days, such as, because it's 3 days.
Okay, program today. Okay, so we wish you the very best.
Thank you. And the launching is taking place at the Civil Servants Auditorium at the ministries. Okay. This morning.
People are invited to be there if they can?
Yeah, invited.
All right. Yep. We wish you the very best. We'll be there to cover it. Thank you for your time. All right, so coming up shortly is Showbiz. Today we're going behind the scenes where Adam was shooting his video. So here's Showbiz for you today.